Starting behind schedule. My name is Ruth Usman and it's 9:24. This is Human Rights Radio 101.1 FM. Today on X-Ray, well, we're taking a little bit of a different dimension as we have some guests with us in the studio, and we will be talking about a health-related situation. We'll be talking about leprosy today on X-Ray, and I have the pleasure of introducing very interesting people to you this morning on the program. First of all, January 28th was World Leprosy Day, and it is for that reason and many more that we have the people that we do have in the studio this morning. We have Mr. Teve Anyo. He is Head Funds Development, the Leprosy Mission Nigeria. Okay, I just had to. I hope I got it right,
yes,
Mr. Teve.
Yes.
All right, you're welcome. We also have
much.
Mr. Adebayo Peters. He is from Leprosy and Bruley Ulcer Focal Person at the National TB and Leprosy Control Program. You're welcome.
Yeah, thank you.
We have Lilibet Evaristus, a member of Integration and Economic Advancement. I missed something out, yeah? Okay, can you help me?
You said what?
Yeah, I missed. Is this dig?
The
okay,
idea?
I'm just something is written here, and unfortunately, I'm not getting it. But you are from.
I am from the integration.
Okay.
Dignity.
Okay.
And economic advancement.
Basically that.
Associations of persons affected by leprosy.
Okay.
Yes.
All right. And finally, but not the least, we have Dr. Josephine Okechukwu. I got that right?
Yeah.
Okay. Dr. Josephine is from TB and Leprosy Control Officer, FCT.
Good morning.
Good to have you on the program today. So I would like for us to use just perhaps 60 seconds each to quickly intimate the listener of what exactly different age, will I call it organizations now or agencies, what exactly you do. Let's begin with Mr. Teve.
Okay, thank you very much. And the Leprosy Mission is a Christian non-governmental organization operational in nearly 40 countries.
Okay.
And in Nigeria, our vision is to see people affected by leprosy empowered to live meaningful lives, to advocate for their rights and contribute to a more inclusive society. We began our work in Nigeria in 1986, and we got registered in 2001.
Okay.
I'm Mr. Adebayo. I'm the Leprosy and Bruley Ulcer Focal Person from the Federal Ministry of Health. I'm the focal person, and under the Federal Ministry of Health, in particular the National TB and Leprosy Control Program, we have about 4 different organizations which is known as the ILEB. They are actually to look into leprosy activities in Nigeria. We'll have the Leprosy Mission Nigeria. We'll have the German Relief Association based in Enugu. We'll have the Demia Foundation based in Ibadan. And we'll have the Netherlands Leprosy Relief, which is based in Jos.
Okay.
These 4 organizations actually look at leprosy activities in Nigeria. And we'll have other organizations that actually look into leprosy. We'll have the Junior Chaban International, which also assists us. And then we'll have the Lions Club, which, of course, also assists us. But above all, the drugs for the treatment of leprosy is actually donated to us through WHO. So WHO provides both technical and logistic support, just as the ILEB organization does. And in each of the states of the federation, we'll have about 37 program managers who look at leprosy in each of the states, down to the local government, where we'll have about 774 TBLS, that's the leprosy supervisors who look at leprosy in all the states, in the local governments.
Okay.
Thank you.
All right, thank you for that.
Okay. And basically, IDEA, there associations of persons affected by leprosy, as I have said earlier on. Our own is just to see that there is a holistic transformation in the life of persons affected by leprosy, giving them sense of belonging, hearing their voice, seeing to their welfare. Yeah.
Okay, so now let's come back to Dr. Josephine Okechukwu.
I am the coordinator for FCT, tuberculosis, leprosy, Buruli ulcer, and NTD program. We coordinate all the programs relating to leprosy, tuberculosis, and Buruli ulcer now that is coming on board with some other skin diseases. Leprosy, tuberculosis has been a problem in FCT. We have about 102 health facilities that we do such activities that concerns tuberculosis and leprosy and Buruli ulcer.
Okay.
We domicile in the public health departments of the Health and Human Service Secretariat of the FCT. For leprosy control program, we operate across both in the private and the public institutions in FCT. So as at now, we operate in the 6 area councils of FCT, coordinating and implementing these programs. So our responsibility is simple: identifying all the cases that have leprosy, Buruli ulcer, and tuberculosis. We go out, look for the cases, and get them on treatment. We have the drugs available,
okay,
because we are being supported.
All right, I do understand that basically one of the reasons why we're having this conversation is to create more awareness about leprosy to the listening public. So let's quickly find out a few things that we can about this disease known as leprosy. What really is it and what causes it? Leprosy
is a chronic skin disease that affects basically the skin, the peripheral nerves, the upper respiratory tract tracts, and eye. It can affect any part of the body. It's a disease that is caused by a special organism called Mycobacterium leprae. Primarily, it affects the skin, and when it affects the skin, it goes on to affect the nerves. The nerves, we all know that the nerves coordinates the activities of the muscle. When it affects the nerves get enlarged, and then progressively, if it is not treated, this affects the nerves, and the nerve function will be derailed, and at the end of the day you have nerve damage. That's what causes all the complications and deformity that we see in leprosy.
Okay, so in simple terms, what kinds of activities does an individual involve himself or herself in that will predispose him or her to actually having leprosy?
Leprosy is basically a problem of the poor, and we know the poor people live in environment that is not too hygienic.
Okay.
It has its own problem because of the environmental issues that come with it. Normally, a case of leprosy, somebody gets leprosy from the environment through breathing of the infected air. This organism, Mycobacterium, is airborne. Transmission is airborne. If you have an untreated case of leprosy that is in the environment, where he coughs, sneezes, or opens his oral cavity, what happens? The organism comes into the air, and anybody around him or her inhales it. If the person's immunity is low, the person might come down with leprosy. Normally, it doesn't manifest immediately. It takes some time, about 2 to 5 years, before you start seeing the signs and symptoms of leprosy, which comes up in different forms.
Okay. So
environmental factor has something to do with leprosy.
And you said unhygienic condition, living condition.
Yes.
All right. What are these symptoms?
The symptoms of leprosy, like I said earlier, transmission is airborne. If somebody that is at risk gets the organism, what happens? The microorganism goes in through the respiratory tract, and initially the person will have normal flu-like symptoms like cough, catarrh, upper respiratory tract irritation, and infection. Then it stays quiet for some time. This organism now goes into the skin, goes into the nerves to start causing its damage, which is long-standing. After some time, what do we have? You have the skin manifestation in form of skin patch. It could be in form of skin patch or a nodule, or you see it like nodule is, by the way, a swelling that's about 2 or less than 2 cm in diameter. It can grow and continue like that. Then it affects the nerves. You have the nerves being swollen, the swollen nerves, and it could be painful, or at times it's not painful. With the progression of the disease in the body, it affects other parts of the body. So when you see it affecting them, going into the body, most of the time this organism have predilection or affinity for the cool areas of the body. That's why it affects the face of the individual, the nose, the eye, and then the limbs, the hand and legs, where you have the peripheral nerves being involved. So it can progressively damage the nerves. When the nerves are damaged, you now have loss of sensation. Okay. Because the nerves are damaged, you don't have sensation in that area of the skin that is affected, or the area of the nerve that is being supplied by the nerves. So
when you're touched, you don't feel.
You don't feel.
You just become numb.
Yes, it's painless initially. Then at the end of the day, you lose sensation. When there is that loss of sensation, progressively, because somebody that is not feeling anything, you don't even know. Because of that, people that have leprosy, they don't know when these limbs start falling off. It can result into ulcer because the nerves supplying these areas are not functioning very well. The body will start, the limbs will start growing ulcer, having wounds, and they start falling off because there is no sensation. You have the complications of that trauma to the nerves.
Okay, so is it something that can be treated, or something that one will just have to manage for the rest of their lives?
Leprosy is treatable. One is preventable. It's something we can prevent. Okay. It's something that we can treat because the drugs are readily available. The mainstay in the management is diagnosing that patient early. Early diagnosis and prompt treatment. We have the drugs in our facilities. So once you commence the drugs, the organisms are being cleared out of the body. The person recovers fully. If it's early, if it is discovered early, the person recovers fully without any complication, no deformity. But with late presentation, that is when you have all those deformity, which at times are irreversible. When you have such amputation of the limbs, it's irreversible. There's nothing you can do about it.
But you did say sometimes some of this, once you even get this virus here, you may not know, like until after 5 years before it begins to. So how would one, I mean, if after 5 years, that is when you're going to the hospital, is that not too late?
It's too late. That's why we're talking about it.
So how else can one actually detect that perhaps these symptoms could be leprosy?
The symptoms basically are patches, skin patches that are abnormal. It's out of the normal coloration. You have discoloration of the skin that have no sensation, with loss of sensation around that skin. It's one of the signs of leprosy. And then you could have a swelling on the body, any part of the body, especially the limbs. And then the nerves that are swollen are painful enlargement of the nerves. When anybody have that, you think of leprosy. There are so many pictures that we have that can show you that, oh, this person might have leprosy. The basic thing is what? The skin patch that is lost, that with losses of sensation in it. Then the nerve, painless nodules that you have, like a growth. It could be in form of nodule, it could be in form of plaque, or the nerves that are supplying the limbs become numbness in the extremities, in the hands, in the legs of where the person that have the infection. And you have discoloration on the face too. You have so many swelling or discoloration or distortion of the skin in the face when the person has the leprosy. So anybody that see any of such pictures in their body or such lesions should go straight to the hospital and get tested. We have a way of testing it to diagnose leprosy.
Okay, let's go to Mr. Adebayo now. I mean, you are from, you're the focal person at the National TB and Leprosy Control Program. So looking at, you know, the entire picture with Nigeria in mind, are there particular areas in the country that, I mean, people are more likely to be infected by this?
Yeah, looking at the statistics for maybe some years now, we actually discovered that more cases are reported in the northwestern part of the country. But that is not to say that leprosy is not everywhere in Nigeria, because leprosy is a disease that can be found everywhere and anywhere, but that is more in the northwestern part. Why is it so? I think because there are more intensified case finding in those areas. Case search is more in those northwestern states because.
Is it anything geographical?
No, it's not. It's not geographical.
Okay.
It's not geographical, and more also, you know, because of the stigma and our beliefs about leprosy. You agree with me that in most parts of the country, particularly in the eastern part, when people come down with leprosy, they have such, they can't come out. They don't come out because if you are out, you'll be cast away, because they believe that you have either offended the gods or you have eaten the forbidden fruit. But in the northern part, it's not like that. Once you have such disease, once such thing comes up, they easily bring themselves out, and you are able to identify, you treat them. So it's not particularly for a particular region, but that is more there because they come out early for those cases to be detected.
All right. So what can you say about access to medical care?
Oh, access to medical care is perfect, just like I said earlier on, and also reiterated by Dr. Okechukwu. Treatment for leprosy is free. The drugs are available.
Oh, okay, it's free.
Yes, treatment is free.
Okay.
The drugs are available. We get the drugs from WHO free of charge. So anytime you need treatment, or there is need for treatment for leprosy, you can access any of the health facilities. Like I said, even in the LGAs or area councils, we have what is known as the leprosy and borreliosis supervisors, whose main job is to look at tuberculosis, leprosy, and borreliosis in those LGAs. They go to all the facilities in those their LGAs, and at the state program, you have the state program managers who are there. So you have people who have both the technical knowledge on how to manage these cases, and that is why I said in each of these zones we have what is known as the ILEB, who covers each of these states. And in all the ministries, you have the TB, leprosy, and borreliosis control program domiciled there. So one major thing we need to go with is treatment for leprosy is free. The drugs are available. Just make yourself available. Once you have loss of sensation, whereby maybe you pick a hot object, you don't feel it, you hit your foot against stone, you just feel you are doing macho man or macho woman. No, obviously there is something wrong. So you need to report such cases, because it's just loss of sensation, and once there is loss of sensation, you are beginning to have the symptoms for leprosy. And when you report early, you don't have deformity. Most of these people you see on the streets, most of them are no longer having leprosy, but what you have there is the deformity.
Limbs and all that.
Because once you come in with deformity, even after the treatment, that deformity will come in.
So is that why the national theme is zero disabilities among boys and girls? Yes,
because it's found out that children are still coming down with leprosy. And by the global standard, we want to have what is known as zero disability among children. Okay. We don't want children to come down with evil leprosy anymore. Because if children are coming down with disability or are coming down with leprosy, it's obvious that the adults are still harboring the symptoms. They are still harboring the bacteria that is causing it. Because if a child comes down, it means that there is an adult who is transmitting it.
Okay. Okay.
So once these adults report early, the children will not have it. So what the global leprosy program is about is to ensure that children do not come down with leprosy. So early detection and reporting and treatment and management of this disease will ensure that children do not come down with disability. Children do not come down with leprosy.
Okay, now let's come to Mr. Teve from the Leprosy Mission Nigeria. You're all about awareness. In what ways are you particularly focusing on ensuring that people really get to know what they need to know about leprosy?
Our program in Nigeria is much bigger than awareness.
Okay.
We have 4 thematic areas. The first is health promotion and prevention of disabilities due to leprosy. We walk through the state leprosy control programs. We support community-based case search to go into communities, to raise awareness in communities, and to screen people who may have skin patches that are suspected to be leprosy, and if confirmed to be leprosy, to link them to the health facilities within their respective regions so they could access treatment. We also have programs around empowering people affected by leprosy to undergo vocational education, and we give them basic access to commence businesses of their own, so they are off the streets and off begging. And we also have programs to advocate for the rights of people affected by leprosy and to also communicate about leprosy. The media discussion like this is one of such activities that we do to raise awareness, but we also have community-based awareness campaign. We work through community announcers, also called the town criers. Before going into communities to screen people, we send those ahead of us to go inform, talk about the disease, talk about the early signs and symptoms, so that people actually come out to be screened. And we're also, one of our final thematic area is actually learning and education. We are very passionate about ensuring that people affected by leprosy are educated and they are not just enrolled but also stay in school, because it's one way that we believe that they can actually graduate and become gainfully employed. As Dr. Okechukwu had mentioned, it's actually a disease of the poor. So leprosy is both a cause and a consequence of poverty. So it's one way that we try to mitigate.
I really wish, any of you to expatiate more on that statement, disease of the poor. Like, you don't have access to certain things, and that's why.
Just like Dr. Okechukwu had mentioned earlier, poor people are more likely to live in slum areas with poor hygiene. Okay, they are more likely to have poor nutrition, and poor nutrition invariably would mean weakened immune system. And so those category of people are more susceptible to coming down with the disease when they inhale the bacteria that cause leprosy. Again, you and I know that leprosy is a highly stigmatized disease, and so people who have leprosy are more likely to not get employed. They are more likely to not enroll and stay and complete school.
And what's the organization doing in that regard? I mean, especially that aspect of stigmatization.
Okay, communication, so people are more aware about the disease, what causes the disease, and to also demystify cultural myths relating to leprosy. We did a study in 2011 in 3 states of northern Nigeria, and I was one of the persons collecting data, and then we had questions to ask people questions about leprosy, what causes leprosy. And for some people, they believe that if somebody steals under Sharia law and his arm is amputated, he becomes leprous. So with that kind of mindset, when you see somebody with who have lost their fingers and their feet digits due to leprosy, they are more likely to interpret that to mean a person who has stolen in the past.
Okay.
So, and then there are lots of other cultural beliefs in the South that leprosy is hereditary, and so all of that.
And it's not?
It's not hereditary.
Okay.
It's a
bacterial
infection. But then
it's very contagious, and for that reason, people will want to stay away. I personally would want to stay away.
It is actually not contagious.
It's not.
Yeah, up to 95%.
But it's airborne, and you wouldn't know when you go. So that makes it
no.
contagious.
Up to 95% of people are naturally immune to leprosy. Like I said earlier, the people who will inhale the bacteria and come down with the disease are those who are immunocompromised, whose immune system is weak, and who are perhaps due to some other disease they've lost their immunity. But you and I, knowing that it's in the air, you and I must have inhaled the disease, the germs, the bacteria at some point. But our body immune system fights it and quarantines it, and we don't come down with the disease.
So don't they get to be quarantined?
No, they don't need to be quarantined.
Growing up, that's just the idea I had, that once you're down with leprosy, you have to be quarantined, like go far away from other people, because... Yeah,
that was because the information was not as clear as it is today.
Okay.
Leprosy is a bacterial infection caused by a bacteria called Mycobacterium leprae. It is completely treatable and it is curable.
Now let's speak with Lilibet Evaristus. What is how difficult? I mean, you're representing people who have been affected, yeah.
Yes.
So what has been the challenge, or what can you say is the challenge that many of those people face?
Yes, the challenge is majorly discrimination and stigmatization.
Okay.
Them not being accepted in their families most of the times, and even in the community.
From the family.
Yes, most of the times you find out that their family will ostracize them. Some because while I have seen most cases where their family will even bring them out to where they know they will get the treatment, but their mind will not still tell them that after this treatment, all about leprosy is gone. They are now fit and proper person to still with them, but they will not accept that. They will leave them there and leave them in the hands of these NGOs that take care of them. After medicine, they will rehabilitate them, and you find out that if you ask most of them, they wouldn't want to go home. You know,
because they don't feel welcome anymore.
Yes, there's no love, there's no acceptance.
So what has your own experience been like?
Yeah, I overcome because I had this love from my family.
Okay.
It was difficult for them to even accept from the villagers that I had leprosy. Yes, my family was really out to say, yeah, whatever you want, you call it, but we don't want to know whether it's leprosy or, as long as my family is concerned, I was just having a skin disease. Even some said it's eczema. Okay, so that was really what helped me too. And when help finally came our way, because my family never kept quiet when they saw the patches all over my body. We were going from one herbalist to the other to secure, to see treatment, you know. But when somebody who knows where it's been treated came and said, I know what this thing is all about, and this is where you will get. And my family were very happy to take me there. And when I got there, I was treated, and I was surprised. Within 1 month, the patches that I saw all over my body got darkened, and I was healed. And even when I came back to the village, the villagers were surprised, and most of them still didn't want to come close. But what the challenge is, love, for the acceptance from the family. If you're being supported by your family, and you can always have sense of belonging, and whatever anybody says outside might not really deter you.
How long ago was this?
This is mine is 17 years ago. Yes, then I was still in secondary school.
So it did not deter you from gaining education
at all. Even when, by the time I got my treatment, I was supported too by the German Leprosy and Tuberculosis Relief Association. They trained me in my education, and I qualified as a lawyer.
Okay. Wow.
Yes.
Okay. So we're speaking with a barrister.
Yes.
I know you didn't quite want me to mention that, but sorry, I couldn't help it. All right. But finally, what's your advice? We have to wrap up now.
Yes, I am advising that this law that is against discrimination against persons affected by leprosy and their families should be implemented, should be inculcated into law, should be domesticated.
Okay.
Yes, let it be implemented. Let people know that it can't be any disease. Okay, and the inclusions of persons affected by leprosy too. Most of them are very capable to do some vocational job. Okay, so let them have sense of belonging. Let government be really committed in giving these people sense of belonging. We can do anything. We can help the community too. We can go back from their settlement and rehabilitate them, integrate them back to their family where they will to find love and it contributes to the development of any society they have found themselves.
All right, thank you very much. Let's hear Mr. Adebayo.
Yeah, thank you. I just want people to know that leprosy is treatable, is curable, and the treatment is free. Once you find the symptoms we have talked about, go to the nearest health center to assess your treatment. Disability can be avoided, and the way to avoid disability is let cases be reported early. And I also want to use the opportunity to thank the organizations that will be supporting the Federal Ministry of Health, which is the ILEB, particularly the Leprosy Mission. We have the German Leprosy Relief Association, Demian Foundation, Belgium, the NLRO, the Netherlands Relief Association, and other organizations like the Junior Chamber International and Lions Club, who has actually assisted us in FCT to carry out advocacy. I also want to let us know that other activities line up for the World Leprosy Day 2018. Tomorrow we are having a road walk from the garden opposite Wuse Market to Utako Market, 8 a.m. Please come. I'm sure you will enjoy it and you'll get to know more about leprosy.
Okay, let's listen to Mr. Teve.
The leprosy as a disease is curable, like we know. Treatments goes between 6 months to 12 months. Okay. But the biggest problem with leprosy is actually the social stigma, the exclusion, and the discrimination. So I'll call on all stakeholders, not just the government this time, but the private sector and every other person to know that leprosy is just like any other disease. It is completely curable, and people affected by leprosy are not to be put away. It is not a contagious disease, and like we know now, up to 95% of people are naturally immune. So there's no need to be afraid of the disease, but to actually include them and to also accept them in society.
Okay, quickly. So that means it can also be eradicated, like we can.
Of course, it has been eradicated in Europe.
Okay.
Yeah, back in the days, leprosy used to they used to have countries in Europe with leprosy, but it has been eradicated, and it can be eradicated. Okay. And the way to eradicate it is to identify every case and treat every case. Leprosy only dwells in two hosts: human beings and an animal called armadillo. And we don't have armadillo in Nigeria. I haven't seen one. So once we can treat every human host, then we can eradicate leprosy.
Okay. Dr. Josephine?
My advice to the people is not everybody have the opportunity of hearing us here now. So whoever is out there that is hearing us and getting this information should try as much as possible to disseminate the information. And let us try to care for people around us, our relations, our friends, anywhere. Whenever you see anybody that has any abnormal skin problem or any abnormal, anything that is abnormal on the body, ulcer, wound, or whatever, please advise the person to go to the hospital, or you can afford to bring the person personally to the hospital. We have what we call our DOT clinic, DOTS. That is where we see patients that have leprosy. Though it is for tuberculosis, both leprosy, tuberculosis, and borreliosis are managed at these clinics. So we have many facilities in our FCT here. All the secondary health facilities have the DOT clinic. All the tertiary hospitals have the DOT clinic, even some PHCs and private hospitals. Please help us so that we can fight against leprosy. We want to bring a beautiful fight to leprosy. If we can eradicate other diseases, if we can fight Ebola and fight Lassa fever, we should be able to fight leprosy as well, so that we have a zero transmission in our community. Leprosy have a problem of ventilation. When we talk about the transmission, it's airborne. So our communities have very poor housing system. So we advise that people that have such cases should help and ventilate their homes very well. When you have good ventilation, the condensation or the accumulation of this organism inside the houses will be few and less. So nobody should be seen dying of leprosy or having all those complications. So let us help ourselves and then keep ourselves clean. Good hygiene. Good hygiene. And we should have very good health-seeking behavior, because our health-seeking behavior in our community is very poor. We've been fighting against so many diseases in this country. If people should change their way of seeking for help whenever they have any disease, we will be able to curtail the transmission of many of these diseases.
All right.
Thank you.
Thank you very much, Dr. Josephine Okechukwu, Barrister Lilbeth Evaristos, Mr. Adebayo Peters, and Mr. Teva Anyo for being with us on X-Ray this morning. It's been a pleasant time. And many thanks to our listener as well. Hope we have all benefited. Stay with us right here on Human Rights Radio 101.1 FM. My name is Ruth Usman, and I'll be back in the 10 o'clock hour on Pro Bono Chambers.
As a business owner, you may be asking yourself for reasons why you should advertise with Human Rights Radio. Well, I will give you 5. 1. We operate a 24-hour Facebook TV that accommodates all our shows and with 50,000 views per show. 2. All around the world, millions of people tune into our station live on our Human Rights Radio app, available on Android and iOS. 3. We are employing over 2,000 conversers ready to attend to all your advertising needs. 4. With our very affordable rates, you are guaranteed the best value for your money. 5. We go beyond radio and can be found on all other social media platforms, including Twitter, Instagram, YouTube, and Periscope, proving that while other stations enjoy listenership, we enjoy followership. The question shouldn't be reasons why you should advertise with Human Rights Radio. The real question is reasons why you haven't. Welcome to Nigeria's first magazine radio, Human Rights Radio 101.1 FM, redefining broadcasting.